So genomics is an NRF2 activator, and the little picture on the right side is kind of an artist drawing of what NRF2 looks like. How does NRF2 benefit your health? Well, it's well known that if you can upregulate this NRF2 activation cell process, that you will see DNA repair. You'll see that your genes are being repaired through upregulation and increase in expressions from the genes at the DNA level. This will increase the anti-inflammatory protection, the cytoprotection that the cells are receiving benefit from these gene expressions. We know that it's been beneficial in cardiovascular disease prevention, diabetes prevention, Alzheimer's prevention, cancer prevention, reversing of aging of the skin. All of these are factors when we are utilizing a good NRF2 activator. The next slide shows the formula itself. We know that it's got rosemary extract, ginger extract, and Sophora japonica. So let's first talk about rosemary. Rosemary has a range of possible health benefits: antioxidants, anti-inflammatory compounds. It improves digestion. It's enhancing our memory and concentration. It has a neurological protection. It prevents brain aging. It's also known as cancer prevention. We know that the benefits of ginger can reduce your risk of diabetes. It's a natural way to relieve period pain. It's an anti-inflammatory. It can settle upset stomachs. It can curb morning sickness. It can help prevent heart disease, and it may even lower the risk of cancer. And there's many studies that are starting to show that. Besides the ginger and besides the rosemary, this product also has a couple of flavonoids that are present in it as well. And I've never been a real knowledgeable person of the benefits of flavonoid until I started reviewing exactly what this formula has in it. And these flavonoids that are being used are very powerful flavonoids. And here are some of the benefits that they bring to the table with this particular NRF2 activator. They delay or prevent the onset of diseases caused by free radicals. So that cytoprotection I talked about. They're best as antioxidants, their anti-inflammatory activity, their improvement of endothelial functions, blood pressure reduction due to its vasodilator effect. It inhibits the LDL oxidation by free radicals. It inhibits platelet aggregation and antiviral and antibacterial principles, and reduced risk of cardiovascular disease. So you can tell just by the early introduction of the three primary ingredients to the formula of this NRF2 activator, we're talking about some very powerful effects that this product can provide. So it's going to be effective in the skeletal muscular disease. This slide gives you some of the ways that is happening, the molecular mechanisms, if you will. Adipose tissues, the molecular mechanics that involve in healing those tissues, the gastrointestinal tract, how it affects that, the myocardial renal tissues and the immune cells, the molecular mechanisms that relate to that, as well as vascular smooth muscle and endothelial cells, and again, the liver and pancreas, the molecular mechanisms involved there. So this next slide is one that was provided to us that really has given a history of several NRF2 activation formulas. And I'm not going to go into what each of these are called. I'm only going to tell you that the green graph on the top is genomics. That's the NRF2 activator that we're using. The genomics is by far the strongest upregulator of all that's out there at this time. And last is talking about the trifecta, Optimen, Genomics, and Link. And the root of disease is oxidative stress and inflammation. This is the area that I studied for several years, and I was looking for formulas that would reduce oxidative stress because I knew that that was the trigger that upregulated. It changes the DNA, changes the gene expressions. And if we could reduce oxidative stress and that inflammation, to me, that was the gateway of preventative medicine. Well, these three formulas, the research behind the ingredients of our formulas is crystal clear. Genomics, Link, and Optimen formulas work through different methods to strengthen an overall protective approach to cellular health. Whether you're doing it through a NRF2 pathway, providing better cytal protection, whether you're doing it at the gut level, where you're making sure that your gut lining is healthy and that all foods and nutritions are being absorbed the way that system was designed, and by improving the function of the microbiome in your gut to be able, again, to allow that system to communicate with all of your organs, including that gut-brain function, that relationship, whether it be Optimen, which is, to me, the primary fire department, which is sending out fire engines in all directions to reduce the inflammation, which is, again, it can be a symptom of many diseases, but if you're not reducing that inflammation, then you're not reducing the damage that it's being caused at the cellular level in a variety of different ways. So each of these products provides multiple unique cellular benefits. They also, as this slide shows, have an overlap. So they're doing some duplication, which is not a bad thing when you're talking about healing the body, the whole body in a variety of different ways. There's a way to upregulate our immune system. We have a way to reduce our inflammation. We have a way to fix a lot of the problems that are occurring because our NRF2 activation has slowed down as part of aging. We can make the body younger simply by turning the cells back on again and letting the cells do the repairs. These products are not fixing problems. They're just telling the body to do the fixing on its own. And with that, I leave this with you, and thank you for being here.